Hello, everyone. I'm Rike Kierkegaard, Program Specialist on Knowledge Management and Learning in the HIV and AIDS section at UNICEF headquarters in New York. Today, I'm very pleased to welcome you all to this webinar on sexual and reproductive health and rights and HIV integration for adolescents and young people. This webinar is co-hosted by the Paediatric-Adolescent Treatment Africa network and UNICEF's Learning Collaborative on Children, HIV and AIDS. So we've organized this webinar in anticipation of PATA's upcoming 2019 summit, which is titled Ready Together, Integrating HIV and SRHR through Clinic Community Collaboration. And this summit will be convened in Johannesburg, South Africa from the 16th to the 18th of October. AIDS is one of the leading causes of adolescent deaths globally, but adolescents living with HIV also facing particular difficulties in accessing comprehensive sexual and reproductive health services. So in response to this, the PATA Summit aims to facilitate a more nuanced response to the complex needs of adolescents living with HIV, and it will also offer an opportunity to hear a range of different experiences on the key issues and effective adolescent-driven solutions. So today's pre-summit webinar will offer a little glimpse into this format. With us here today, we have 4 speakers that will speak to the topic from a global to a local level. We have Dr. Manjula Narasimhan, scientist at the Department of Reproductive Health and Research at WHO headquarters in Geneva. Georgina Caswell, who is currently program lead at Frontline AIDS in South Africa. We have Sister Futhi Dlamini, a Ready Plus healthcare provider from Eswatini. And we have Audrey Nosenga, a peer mentor from Zimbabwe Young Positives. These 4 presentations will take around 40 to 45 minutes and will be followed by 15 minutes Q&A or panel discussion. So before we get started, I would just like to say a few words about guidelines. If you have any trouble hearing or have other technical issues, please send us a message via the chat box and we will try to support you as much as we can. But before writing us, you can always try to log out and log in again, restart your laptop and just double check your audio settings. Also, please keep your mics on mute so we avoid any unnecessary background noise. And throughout the webinar, please do type in any questions that you may have at any point using the chat feature. You can start sending the questions as soon as they occur to you, but we will be taking them after all the presentations. Then, due to our representation from all these different levels today, we would also like to encourage you to submit questions to the entire panel, which can then be answers from these different perspectives. The webinar is being recorded, and the recording and all the materials will be made available online after the webinar on childrenandaids.org. So please do also help share this recording with any of your colleagues that were unable to join us today. Now, without further ado, I would like to introduce our first speaker, Dr. Manjula Narasimhan, scientist who is leading research in sexual and reproductive health and rights at the Department of Reproductive Health and Research at the World Health Organization headquarters in Geneva. Dr. Narasimhan is also functioning as co-chair of the Interagency Working Group on SRH and HIV linkages. So please, over to you, Manjula.
Hi, thank you so much, and good day, everyone. Many thanks to the organizers of this webinar to invite me to present. So I will be giving just an overview of linkages between sexual and reproductive health and rights and HIV, with a focus on adolescents and young people. And as was mentioned just before, my name is Manjula Narasimhan, and I co-convene the Interagency Working Group also with UNFPA, in particular Tim Sladden. So next slide, please. Sexual and reproductive health and HIV share really many of the same root causes, including economic inequality, limited access to appropriate information, gender inequality, harmful cultural norms, social marginalization, and this is particularly important for vulnerable populations of adolescents and young people. And just as one example of why linking SRHR and HIV is important can be seen in the data for unintended pregnancies and HIV risk among adolescent girls and young women. When we have 23 million girls aged 15 to 19 years that have an unmet need for modern contraception, and the estimated number of unintended pregnancies in these girls are about half per year. And then for many of these girls who live in regions where there's a risk of HIV, there's this added risk, not only for STIs, but HIV. And, it is estimated that every week we have 6,000 adolescent girls and young women who become infected. And therefore, a rights-based sexual and reproductive health and HIV response could really ensure that collectively many of these root causes and these overlapping risk factors are addressed in a more systematic and in an aligned manner. Next slide, please. So we can strengthen linkages between sexual and reproductive health and rights and HIV at many levels. And this includes, for instance, at policy levels. And the presentations in this webinar focus on integration at the service delivery level. And this can be understood as joining operational programs to ensure effective outcomes. And modalities include things like multitask providers, referrals, one-stop shop services under one roof, and so on. Next slide, please. The interaction between these levels of linkages at health systems, at legal, at policy levels, as well as integration at service delivery levels, and the potential benefits at outcome or impact levels, it's been articulated in this theory of change that you see on the slide. And the desired sort of impact that we want is to move beyond a disease perspective. It's not just about reducing HIV. It's not just about reducing an ill health, but to improved health and well-being, improved human rights, gender equality, and quality of life. So in the next slides, I'll give just a brief overview of some of the tools and the products that are already available to advance this change. Next slide, please. So since 2004, there's been an interagency working group bringing together several of the key partners who have been sounding the message for strengthening linkages between SRHR and HIV as an essential way forward to provide individuals with the comprehensive, integrated approach to the health services that they need. And this slide shows some of the guidance and tools that have been developed through this working group. Next slide, please. And in July 2018, at the AIDS conference, many more stakeholders joined the interagency working group in a renewed call to action for universal health coverage that links SRHR and HIV interventions. This is a 10-step action-oriented call to action, and it includes, for instance, the need to respond to a people-centered approach. So promoting, innovative approaches that advance SRHR and HIV health outcomes include technological advances, such as digital health, such as self-care interventions, because these are already rapidly transforming how healthcare programs and health service delivery is being envisaged and taking place at this point. And we need to acknowledge that adolescents and young people, and particularly those who are vulnerable, may be accessing health information and services through digital platforms, through interventions that they can do by themselves, like these self-care interventions. And this can lead to maximizing acceptance and uptake of linked services. And it can also improve their self-efficacy, their autonomy, and that is really important for sustainable long-term health outcomes. So in the following slides, we'll just rapidly go through some of the existing tools. Next slide, please. So we have data from 50 countries that exist on providing some baseline indication of the opportunities and the gaps which exist at policy, systems, and service delivery levels through implementing a rapid assessment tool, which was developed again through the interagency working group. Next slide, please. We also have country snapshots that are available for 30 countries and that are currently being developed for many more countries in the coming months. So watch this space, and you will, the next presenters will be looking into this snapshot in more detail. So these snapshots graphically provide an overview of national level data for more than 150 indicators, and they cover a full scope of HIV and SRHR linkages. And what you see on this slide is data available specifically for adolescents and young people that are included in all of the snapshots. Next slide, please. And this infographic brings together guidance that's available from the World Health Organization with a particular focus on linked programs and policies for adolescents and young people. So the available guidance is all here in this one infographic, and will be updated regularly. Next slide, please. And so steps to develop a comprehensive approach for adolescents and young people will require context-specific initiatives. And this document outlines some of the how-to approaches to integrating health services for young people that encompass the multiple aspects of what we term as sexual and reproductive health and rights. And for the more vulnerable among these populations, it will also require strategies that enforce zero tolerance for all forms of coercion, violence, stigma, and discrimination. Next slide, please. And to enable monitoring and measurement of these linked approaches, both a compendium of indicators as well as, next slide, please, an index has been developed to track progress of how well a country is doing at linking sexual and reproductive health and rights and HIV. And this can also be used to support advocacy and funding for improved linkages and integration, but also deepen the knowledge on the drivers and effects of the linkages, and highlight data gaps where further research may be needed. Next slide, please. So the tools mentioned here and many, many more are available in the SRHR and HIV linkages toolkit, which has been designed as a simple to use online toolkit that guides users through the various resources available from all the partners who are working in this field. Next slide, please. So this is my last slide, I think. And we've been saying for many, many years that funding and institutional silos around SRHR and HIV issues does not benefit the people who need health services the most. And I'll end by saying that, we have the messaging, we have the data, we have the tools, we have the guidance to make the necessary changes, to advance a comprehensive, integrated approach to sexual and reproductive health and rights and HIV. And you'll hear now from the voices of youth themselves why these changes are needed so urgently. Thank you very much.
Thank you very much, Manjula, for this excellent overview of SRH and HIV integration, for your very valid points, and also the tangible tools that countries can use to try and strengthen linkages. As mentioned, we will now go from the global overview to a more bottom-up approach and hear from the beneficiary perspective before proceeding with our healthcare provider and program manager. So our next speaker is Audrey Nosanga, who is a young woman from Zimbabwe and also Y+ focal person under the Ready Plus program, which is run under the Zimbabwe Young Positives. So Audrey, over to you.
Thank you so much. Well, my name is Audrey, and I'm speaking on behalf of adolescents and young people living with HIV. As a young person myself living with HIV, I think dealing with my status is very hard, and my hope is that I can be able to get the support when I visit my healthcare provider, whom I trust to understand in a professional sense my status, counsel me, and give me a hope to look forward to tomorrow. Mm, When I go to the health facility, I expect the environment to be welcoming. I expect it to be a place where I can be able to be myself without fear of being judged or rejected, because every day I battle this in my community at different levels. I also expect that a competent counselor, a nurse, or a doctor, or whoever can be able to provide services for me get down to my level and understand what I'm going through and offer me with the support and information or treatment that I need to make healthier choices. I do not expect to get into a healthcare facility and fail to get my art treatment. More so, if I'm able to get this treatment, I expect it to be not expired and enough for me till my next refill date. As a young woman also, I expect access to a wide range of contraceptive options and accurate comprehensive information in line with these options. I I actually expect to be given enough time with my counselor, nurse, or doctor and not be rushed to do whatever I'm doing at the facility, especially making choices about my health. Many times I may have questions regarding my health, and I hope that those questions are answered in a way that I understand. Next slide, please. As a young person, I think good experiences that we may have in accessing services is we are not really economically stable, and and we are so much mobile. So it is important for us to access services that do not cost too much for us, that can be accessible when we can be able to get them, because our busy little lives at school and work, we expect short waiting times as they are important for us. More so, I think it is important for us to interact with providers that do not judge and discriminate us. Having access to information like and condoms and other prevention options and contraceptive options help us make informed choices about our sexual, reproductive, and health lives. As young people, and also as a young person, I'll just say it is usually difficult for me to have an open conversation um, with my healthcare providers, and my healthcare provider being an adult as well um, doesn't make it easy for me to have a conversation with. It'll be very it'll be a very good experience for us to have healthcare providers who communicate with us in youthful language and who relate to us in a respectful manner. And added to that, their ability to maintain our privacy and confidentiality is very important and builds trust within us. Next slide, please. As young people, it has been very difficult to access services at times because of the high hospital user fees. In instances where there is no integration of HIV and SRH services, the costs are even higher. With the striking of doctors and nurses at times, there are no service providers when we visit the facility, forcing us to go back home unattended to. Drug stockouts have been a challenge to us because we end up being given a limited supply of ARVs, and at times, depending on the regimen you may be on, you can be given a week or two supply of art, and you have to regularly come for refill, which becomes a burden with regards to transport costs, time, and user fees. And yes. And in some instances, you are given expired drugs because it's just there to supplement the need. And at times, there is usually one healthcare provider or none at all who is trained in youth-friendly services. And it makes it difficult for us to access other SRH services or information, as we'll be judged for being sexually active. In other cases, the healthcare providers are too frustrated to even provide responsive services. We have mental health issues that we are dealing with, and we have often gone unnoticed and unaddressed, forcing us to battle these on our own. In worst case scenarios, suicide, treatment failure, drug abuse, and poor adherence have been negative effects on us. Next slide. Next slide, please. As a young person, I really believe that if young people are taken and seen as partners rather than only beneficiaries in service provisions, we'll be able to integrate HIV and SRH services. More so, the investment in peer support models is critical because young people can relate to their peers more freely and openly without fear of stigma and discrimination. For us, building relationship based on trust is so important as it allows us to build a partnership between health providers. People may not really understand, but for us, safe spaces are little havens for us from the harsh realities of our everyday lives. And therefore, it's important to invest in safe spaces, confidential spaces for counseling and information sharing. If it means anything, really, healthcare providers need to be trained to have knowledge and skills around lots of health issues that we face and to be great counselors. I think I'll just close by thanking all the young people that I work with every day who inspire me to speak up. And I would also like to thank my colleagues from ZRIPAS for the continued support, and also PATA and UNICEF for giving us this opportunity. Thank you.
Thanks to you, Audrey, for sharing your experiences, your advice, and telling us what young people want and need. I think that definitely gave some food for thought for all of us. Our next speaker is Sister Futi Dlamini from the Kingdom of Eswatini. She's working at the Pikes Peak Government Hospital. She's a midwife, a community health and mental health nurse who's providing sexual and reproductive health and rights and maternal services to adolescents and young people who are both HIV positive and HIV negative. Futi, over to you.
Hello everyone, my name is Sister Futi Dlamini. As I have been introduced, I'm from the Kingdom of Eswatini, Pikes Peak Government Hospital, and I provide services to the youth, especially in the maternity wing. Next slide, please. I'll start by sharing the data that we have in Swaziland that is current. The intrinsic connections between HIV and SRHR are well established, as stated by the previous speakers, especially as HIV is predominantly sexually transmitted or associated with pregnancy and childbirth and breastfeeding. And the population size is about 1.27 million. The life expectancy at birth is 48 years and the fertility rate is at 3.3%. HIV is a leading cause of death in women of reproductive age. So for new adult HIV infections, for the women, we have about 4,800 women, and then among men, we have 3,900. Then for HIV prevalence between the ages of 15 to 49, the percentage is 27.7%. Then we have people living with HIV. For women, it's 120,000, 80,000 for men, and 19,000 for children. And then for AIDS-related deaths among adults, ages 15 and above, for women is 1,300 and 1,600 for the male. People living with HIV receiving ARTS, 15 years and above, we have 66% of women and 52% of males, and 0 to 14 years, we have 43%. HIV testing currently in the general population of 1.27 million is at 38.7%. Next slide, please. HIV-associated maternal death contributes to maternal mortality. The data that we currently have for Swaziland, the maternal mortality ratio is at 389 per 100,000 live births. And then maternal deaths that are attributed to HIV are at 16.6%. And then HIV transmission to infants can occur during pregnancy, as we all know, or childbirth and breastfeeding. This is more likely where there is acute maternal HIV infection. For mother-to-child HIV transmission rate after breastfeeding, we have a rate of 8.3%. And then pregnant women who know their HIV status, we are at 97%. Because what we do in maternity, there is no way that a woman can deliver a baby without knowing her status. So even if the woman comes to deliver, the first thing that we do is that we check that woman if that woman comes in with an unknown status, so that we can prevent that woman from giving the child HIV. Then the demand for family planning satisfied with a modern method of contraception between the ages of 15 to 49 years is at 76.5%. Certain sexually transmitted infections significantly increase the risk of acquiring and transmitting HIV. The number of adults reported with syphilis is 699, and then male and female condoms provide triple protection from unintended pregnancies, HIV, and other STIs. Condom use at last 6 is 71.5%. And then demand for family planning satisfied with a modern method of contraception for women living with HIV in the ages 15 to 49. The data is not available there. Next slide, please. Adolescent-friendly service provision in the clinic. I think it has been mentioned why the integration of HIV SRHR services, but it must be responsive to adolescents' special needs and circumstances. Though even in countries with good public health systems, healthcare for young people is usually a neglected area that lacks clear guidelines and political will. So what does it look like in my clinic? I'm going to talk about my experience actually here and what is supposed to be happening, or what is really happening, the challenges later. Providers and staff, as Audrey had mentioned, they must have knowledge and skills on how to provide these services to adolescents and young people. Counseling and training, communication and interpersonal skills, respecting privacy and confidentiality are also key. Next slide, please. Then concerning the health facility programming, the youth always speaks out. There's nothing for them without them. So it's very important to actually involve the youth in whatever we design that is going to be of benefit to the youth. And also feedback is very crucial as well, so that we know if we are going towards the direction that we want, if we are going to obtain or rather achieve what the program is intended to achieve. We should offer a wide range of services available, of which we do, though we have challenges when it comes to stockouts. Then the flexible hours, and sometimes we have a shortage of staff, so most of the time we cannot actually have flexible hours. The number calling systems and not names, that one we do. Youth-friendly corners we have, and they're working for us. Next slide, please. Adolescent-friendly services are not adolescent-friendly. When they are not adolescent-friendly, adolescents may experience stigma and discrimination, leading to poor adherence, or actually the adolescent may stop taking their treatment altogether. The adolescents may not return to the clinic and therefore adhere to treatment, and this gets to be costly and very difficult because you have to outsource more people or staff who are trained to actually do follow-up visits or home visits. Adolescents may not feel comfortable talking to health providers about sexual and reproductive health and rights. This was also mentioned by Audrey Nosenga as well, that as adolescents, you know, when they come to the facility, they expect to be welcomed warmly, they expect to be respected, they expect their confidentiality to be respected and put into consideration, and that healthcare provider to be well-trained and skilled. Next slide, please. Yeah. Slide, please. HIV and SRHR integration in service delivery. Providing integrated service enables clients to receive as many quality services as possible at the same time and in the same place, especially at the service delivery level. So we always try by all means to have all the services, give the same appointment for FP, give the same appointment for hypertension, give the same appointment dates for whatever service to avoid the adolescent having multiple visits. And in that way, we're trying to be cost efficient, as Audrey mentioned, that as young people, they do not have money. They are not yet stable financially. So they can't be going forth and forth to the health facility. Next slide, please. HIV and SR integration is well on the healthcare workers. It is our duty to providing service helplines, which should be available 24/7 to the youth. Well, in Swaziland, we do have a program that is supported by the Ministry of Health. It is called U-Report, and you just dial in or actually ask questions on the phone. It's got the same code internationally, then like regionally they have the different codes. So everyone is able to ask whatever health-related question they may have. Then safer sex education to prevent sexually transmitted infections, HIV and unwanted pregnancies. This is done at all levels and in the hospital. Family planning and HIV services, including fertility protection to those living with HIV. We'll get into, I think there'll be a lot of questions there, but we'll answer them after the presentations. Prevention, diagnosis and treatment of sexual and reproductive health related cancers, then strengthening community voices, ensuring they are heard in and policy making to protect them from harassment and abuse. Next slide. Okay, and then how are these services integrated at the front line? We have teen clubs that take place every first Saturday of each month for young people, and we do have youth-friendly corners, which we also have the challenge clinic for pediatrics, and it starts from pediatrics, including the young people and the adolescents, on a Tuesday. And family planning services are offered to young people as well under one roof. The challenge that we have when it comes to that as a healthcare providers is that not all the healthcare providers are trained. So if the healthcare provider that is actually based in the youth-friendly corner is not feeling well, is off sick for some other reason, or actually on leave, when these young people come to seek for the services, and if they don't find that healthcare provider, they always go back because they don't want to be sharing their problems or with any other healthcare provider. So trust is very important. Then IEC materials and condoms in health facilities. We do not have IEC materials that are in our own language. So it's not everyone who is literate in English. Through psychosocial support by the CATs and social workers, healthcare providers as well, we work with them trying to close the leaky cascade as well in the community and the facility. Like I've mentioned, there are challenges to delivering integrated services and solutions. Next slide, please. Okay, those are pictures. If you look on the top left, that is our room that we have for our challenge clinic and our youth-friendly corner, because they're on separate days. You can see that that's an MDT, which is a multidisciplinary team. There's the doctor, there's the nurse, and there's the CAT, which is the community treatment supporter, and the focal person for the adolescents and young people. We also involve the social workers and other doctors that are from outside, such as Baylor. Next slide, please. Evidence and experience show that strong SRH services in a fair society can prevent new HIV infections from happening while helping those living with HIV to enjoy healthy lives. Good sexual and reproductive health and rights is good, HIV prevention, treatment and care. But above all these, we should consider that the root cause in as much of new HIV infections also stems up from poverty. Next slide. Okay, thank you. That was my last slide. This presentation was by Futhi Dlamini, who is a health worker at Pikes Peak Government Hospital, Kingdom of Eswatini. Thank you.
Thank you so much, Futhi, for sharing your personal experiences of providing integrated services for adolescents and young people. It was very inspiring to hear. I would like to introduce our last speaker, Georgina Caswell, who joins us from Cape Town today. She just transitioned from being program lead at Frontline AIDS to being head of programs at the Global Network of People Living with HIV, GNP+. Both Frontline AIDS and GNP+ are part of the Ready Plus program, which she will draw on as she shares her reflections on HIV and sexual and reproductive health and rights integration from a programmer's perspective. Over to you, Georgina.
Okay, thank you so much. And hello, everybody. So as Kath said, I'm going to be sharing my experience of working on integration programs. One called Link Up, which was over 3 years. And it was from 2013 to 2016, and then the Ready portfolio of programs since then. So those are the two sets of programs I'm going to be referring to, Link Up and Ready. And I'm going to be sharing just our experience of being an HIV organization that's trying to integrate SRHR into the work that we do. And working with government and youth-led organizations and NGO partners, the private sector and researchers to do that. So next slide. So what needs to change for good sexual and reproductive health and rights? So from a planning perspective, what we always think about is the importance of working at different levels. And you have to work at these different levels in order to be effective in doing SRHR and HIV integration. So there's the individual level, individual peers, relationships, household level. There's then the community level, then there's the services level, and then there are the policies and structures. These levels are, they kind of reinforce and influence each other. So if you work on the policy level and you do a really good job, it can have a really positive impact on how you deliver services. Or if you do good work within the community, it can have a really, good impact on the individual level. So they reinforce each other, but we don't often have, programs that are working at all these different levels, but it's really important to do so when you're doing really good SRHR and HIV integration. So next slide. So I'm going to take us through the different levels just to say a little bit about each and the kinds of interventions, and just refer to some practical tools in case anyone wants to do this kind of work, and potentially tools that you haven't necessarily engaged with. So at an individual or peer or household level, the point is about making sure that all of us as individuals are aware of our SRHR and HIV, information, but also where to access services. And this is the starting point, really. You need to be aware as an individual. You need to have access to the information, but you also need to be able to have the confidence and, the agency to be able to kind of, to access that information and service. So that's why this particular level is important. Next slide. And the kinds of interventions that we've done through our programming are, counseling around sex and relationships and contraception, health information and education. And you'll see on the slide like an image of some IEC materials that have been developed through the Ready Plus program on a range of topics. They're actually other topics, and they're available on the Frontline AIDS website in lots of languages and for different age groups. So just having access to really kind of good, up-to-date, sex-positive information that also works for contexts that are quite conservative. Improving risk perception, peer education, and support. I saw a question on the chat group about, are there any great peer kind of models out there? Well, under Ready Plus, the peer model that we've been scaling up is the CATS model, the Community Adolescent Treatment Supporters. And this is a model that originated in Zimbabwe with Africaid Jandiri. And I also saw in the chat that there are 24 cats doing their level 2 training who have listened in to this webinar, which is really awesome. So great that you guys are listening. So that's a good example of a peer model that is about young people supporting each other to be able to, live with HIV, to take treatment, to manage how, your mental health, but also with integrated SRHR information in there. There's community outreach, there's working with groups, and it was great to hear Audrey talk about the importance of safe spaces. At Frontline AIDS, we have a tool called Life Skills and Sexuality. I should have put an image, and it's just been like revamped, the Life Skills and Sexuality tool. And that's for use in safe spaces as well. So anyway, these are some examples of interventions at that individual level. Next slide. So at a community level, it's really important to address social norms and cultural practices and beliefs, because these could either help us or really get in the way. And I mean, this is really, it's a very huge kind of area of work, but really important. Addressing issues of gender, issues of diversity, sexuality, respect for people living with HIV. All of this is important when it comes to addressing stigma, which ultimately, enables people to be able to enjoy and access their SRHR. So next slide. So the kinds of interventions that can happen at community level, these are the kinds that we've done through some of our programming through Link Up and through Ready. So there's community education on HIV and SRHR. This comes in many, many, many different forms. Under Ready Plus, we're working with REPSI. They are a group that work on psychosocial support. They've got tools like Celebrating Life, Journey of Life. They've got a tool that we really like called Flip It, and that focuses on SRHR in particular. And it's for, talking to parents, talking to community leaders, influential groups, to get people to just speak up about these issues and to share different perspectives, to try to shift those norms just a little, just to try to shift them a little bit further. Work with the media, drama, radio. In Burundi, RNG+, the network of young people living with HIV, they recently did a project where they developed podcasts on SRHR and have been using these podcasts online, but also in safe spaces to get people to talk about those issues, tricky issues around using drugs, readiness for sex, masturbation, issues that are often not vocalized. Other examples here. Let's move to the service level. And then at the service level, it's really important to be able to improve access to really high quality integrated services. And we've just heard from Futi. And just to say that, we really need access, there are many different types of services, right? So there's facility-based services, there's community-based outreach services, there are private facility-based services like the ones that Marie Stopes, for instance, provides. There are also like projects that, you know, market commodities like condoms. In the image on this slide, it's a voucher. It's like a kind of voucher scheme that we did under Link Up with Marie Stopes. So I think there are lots of different ways to try to actually provide services. Next slide. And interventions to support integration include the training of healthcare providers. There's a tool that we have at Frontline AIDS here called the SRHR 101, DC SRHR and HIV 101 guide. And that looks at what are the core aspects of HIV programming, what are the aspects of SRHR programming, what does it mean to provide services to young people, and what does it mean to provide services to young people from key populations? And this is a tool that can help to be able to do good integration. Our colleagues at PATA, Ready Plus, they've been leading the trainings around integration, and they even have like a service charter. And I think that might be Sister Futi there in that picture. And the service charter is about, you know, about providers kind of saying, you know, we want to offer a welcoming service, and, you know, we want to be able to respond to the need of the person in front of us. There's also the training of peer outreach workers to increase demand for services. And there's also, you know, really influencing training curricula for healthcare workers at country level. Okay, next slide. And at a policy level, our lives are influenced, you know, by policies and laws that govern us. And so when we are trying to do integration, policies matter because they can put us off what we're doing, or they can really support us. We can really leverage policies. And at the moment, for instance, when it comes to integration, you know, one of the kinds of very unhelpful policies is the global gag rule. I don't know what else I should say about that, but, you know, the point is that there are policies that can be helpful, like adolescent SRHR policies that have been, and guidelines that have been developed at country level, but they also need to then be actually implemented. Having a coordinated response between ministries, like the ministries of education, health, social services, that also really helps, and technical working groups that bring together these different agencies. Next slide. In terms of interventions at that policy level, you know, very much advocacy for those policies that really promote integrated SRHR and HIV health services. There's a program called Ready to Lead, and it's a girl-led program in Zim. And, you know, they're looking at those issues to do with like age of consent, and operationalizing the adolescent SRHR policy guidelines in Zim. You know, so advocacy really, really important. Looking at budgets, health budgets, and how they are spent, very, very important. I've already talked about implementation of policies, but also, you know, community consultations, really checking in on what is it that people want so that we can speak up for that, and making sure that, you know, there are young people at the table who are sharing what it is that they want, what they need from their services, like Audrey just did. A couple of tools to support this. Y+ have developed a tool called Ready to Advocate. So you can see that on the Y+ website. And that's very much advocating for young people living with HIV, but it has a very strong kind of integration vibe to it. There's also the Step Up, Link Up, Speak Up tool, which is again about youth advocacy, but it's youth advocacy again, looking at integration. Okay, and then next slide. So in terms of challenges, what we've seen in trying to work at these different levels is, you know, how do you introduce new areas, new topics? You know, how do we introduce cervical cancer screening? How do we suddenly, have a deeper focus on STIs without overburdening existing services in a way that would compromise the quality that adolescents living with HIV were already getting. We need to recognize that individuals who are trained to be able to work in safe spaces or in facilities, we can't be specialists in absolutely everything. But it's important to know a bit about different things and to know where you can go for information and support. There's a big challenge still, even in this day and age, about seeing kind of family planning as part of SRHR as a women's thing. But how do we get adolescent girls and boys and young women and men, but also the men, to really think about SRHR as being something that matters to them. I think we need to do some better kind of communications there. Making services work for adolescents and young people from key populations. We've learned through Link Up and through the READY programs that peer-to-peer is the way to go. But we still have to think about those who are really not being reached. How do we keep being creative and creating, investing more and creating more space for them? And we need to really at donor level, really encourage a move from parallel to integrated services. There was a question in the chat about, why is this not happening? We've been talking about integration for years. Why is it not happening? This is part of it, power and money and how resources are allocated. I think added to that is just operationally, it's quite complex. It means that you have to put in the extra kind of thinking and the effort, but also kind of this investment at all levels. Integration isn't just about the health facility, it's about the community and it's about the collaboration between the health facility and the community. And it's also about investing in coordination. Really, really important to invest in coordination. So in terms of opportunities, partnership, definitely the way to go with integration. Recently, there have been several kind of developments around DTG for women of reproductive age, recommendations around that have kind of sparked discussions about SRHR, of women living with HIV. The ECHO study results, which were looking at the link between HIV risk and hormonal contraception, again, really encouraging us to think about those links explicitly between SRHR and HIV, and really encouraging us to think about how we invest in really good kind of literacy, so that all of us can kind of understand what it means for us as individuals and support other people to be able to enjoy the SRHR. There are a number of guidelines and policies that have come out over the last year or so, and the latest being the self-care guidelines, which again refer to like a range of SRHR and HIV interventions that the WHO say, these are ready to go. We should be really encouraging implementation. So we should make good use of these guidelines to call for integration. So thank you very much.
Thank you so much, Georgina, for this very comprehensive overview of the program's perspective, takeaways, and very interesting tools. So we've run a little bit over time. However, we'll keep the Q&A open for a little bit longer for those that are interested. So we'll have about 10 minutes. We have had quite a bit of questions coming in. We have a distinction in the chat box between sending to all panelists and all panelists and participants. So not all are visible to everyone. So I will just read some of the questions out loud. First of all, I would just like to convey a message from the Y+ Positive Network to everyone, saying we need to integrate mental health in the service delivery package with focus on HIV, SRHR as a message from young people living with HIV. Then there's a question from Ann Lomber, but also coming from several different participants. How are we ensuring interventions like the cats are expanded into other countries? Also, how can we ensure that they are sustainable, especially when these interventions are championed by NGOs or partner organizations? And I think this question is relevant to all of our panelists, really. So anyone that wants to start? I'll throw it to Manjula. She's still there.
Yeah. Trouble hearing. Can you say that question again, please?
Yes. There's a question on how we ensure that interventions like the cats or other more integrated, comprehensive interventions for adolescents and young people, how can we ensure that they are sustainable, especially when those interventions are generally championed by NGOs or other partner organizations?
Yeah, I mean, and I think that as you read out, some of the questions that have been placed in the chat is, you know, how do we make this happen, and what have been some of the challenges in integrating, you know, despite the fact that we've been saying this, and we hear the youth asking for these kind of interventions. And I think funding, you know, the funding remains very siloed. It goes towards either an HIV intervention, or it goes towards a reproductive health intervention. And I think, you know, making it sustainable or long-term or people-centered will require funding that is more innovative and that actually, you know, walks the talk in terms of linking these various approaches long-term.
Thank you. And Futi, about the same topic, we have a question about what your plans are for sustainability in your clinic. And the commenter is saying that most of their youth-friendly services in Kenya fail once the project is over and once external funding is ending.
Okay, what we are planning to do, yes, it's true that most of the funding is actually coming to an end. So what we're trying to do with the Ministry of Health or the SRHU program, which is under the Ministry of Health, we are trying to find a way to actually absorb these our cats, which are the community adolescent treatment supporters, into our government system, just like the community expert clients, because they are being paid by the Ministry of Health. Thank you.
Then we have another question to Manjula from Laura from the Institute of Human Virology in Nigeria. There is a challenge in accessing PrEP by adolescents in Nigeria. What measures do you think will have to be done to integrate PrEP into the healthcare service delivery? Sorry, Manjula, did you hear the question?
Yes, sorry. Yes, I did hear the question. And just to say, because of the lack of time that we have, it's going to be hard to respond in detail, but simply to say that there is an extensive program by the HIV department of the World Health Organization in supporting PrEP and interventions in countries. And I don't know whether you are planning for a separate webinar around this, but this is, there are not only opportunities, as was mentioned during this webinar, but several very successful programs in rolling out PrEP. And I think that we don't really have time to go into this now, but I'm happy to send information.
Thank you very much. We just have we have a bunch of other questions that we'll forward, but because of the lack of time, we'll just take one more question and seek to answer the rest of the questions virtually. And there will be additional webinars planned, both for the PATA Summit in October that is around HIV and SRH, going into more detail about the different service delivery models, but also about PrEP and all other relevant topics within this area. So the last question is, do we have any interventions tailor-made for young key populations? And there's also a similar question about whether we have any tailored, or tell us more about tailored approaches for engaging with youth from a range of different backgrounds, for example, rural, urban, girls, boys, and key populations. So Georgina, do you want to answer this question?
Yes, so at Frontline AIDS, there's a program that we are supporting called Ready Teens, and it focuses on adolescents and young people from key populations, in particular, adolescents and young people who are selling sex and using drugs and who belong to a sexual minority. So I don't know how, for whoever wants to know, well, you could look on the Frontline AIDS website and somehow connect to colleagues, or I don't know, maybe speak to yourself and we'll connect you and share tools. But there are some tools that have been put out there, in particular by the Interagency Working Group that looks at young people. They did a whole series around young key populations and what works and what doesn't work. And so that's also a good set of
Thank you, Georgina. Yes, as mentioned, I'm scared we're out of time. We'll have to conclude the Q&A. We will seek to answer the remaining questions virtually, but if there are any other questions, please do send them to us and we'll try and get back to you. We will also post a PowerPoint and a recording of the webinar on the childrenandaids.org website after today. So I'd like to thank our 4 speakers once again for the excellent webinar. We've had a bunch of comments coming in, thanking everyone, especially to Audrey for speaking out and sharing your very personal experiences. And I think there's one comment from Wole that really captures it very well. Says, great that all of the key points are coming out and from very important perspectives: adolescents, young people and health workers. Integration, engagement, adolescent-friendly services are very important, and the models to deliver them are just as important. I take Audrey's point that those models need to be harnessed, scaled up, monitored, evaluated, and quality improved when necessary, and then shared. And this is exactly the theme of the PATA Summit. So if you like this pre-summit webinar, please tune in on October 16 and 18, where we will be broadcasting daily webinars live from the summit with recaps of the main presentations and discussions that will go into much more practical details, covering different service delivery models and skills for SRH-HIV integration. So thanks to all of you who took time to join us on the webinar today. We hope it will be very useful to you in your work, and have a great rest of the day.
Thank you. Bye.
Thank you.
Bye.
Thanks very much. Bye-bye.
Wow, that was really